Have you ever noticed yourself clearing your throat at the dinner table, in the middle of a conversation, or even waking up in the morning already reaching for water just to wash something down? You're not imagining it. And no, it isn't just allergies. What most people don't realize is that persistent mucus in the throat after 60 is almost never about one simple cause. There are actually 6 specific reasons this happens, and most of them have nothing to do with being sick. Some of them are hiding inside your medicine cabinet, some are happening deep in your lungs, and one of them is so fundamental, it affects nearly every single person over the age of 55. Stay with me, because by the end of this video, you'll finally understand exactly what's going on and what you can actually do about it. I've been practicing medicine for over 3 decades, and I can tell you, this is one of the most common complaints I hear from patients over 60. That constant feeling of something sitting in the back of the throat, the clearing, the discomfort, the frustration of it never quite going away. And almost every single one of them has been told the same thing. It's just your age. But here's what I want you to understand today. Yes, your body changes after 60, but that doesn't mean you simply have to live with this. The throat, the nose, the lungs, and the swallowing system all work together, and when even one part of that system shifts, you feel it every single day. Today, I'm going to show you exactly what's changing, why it's happening, and, most importantly, what you can do to finally get some relief. Before we dive in, I want to ask you something, and I'd love for you to answer honestly in the comments below. How many times a day do you find yourself clearing your throat? Once or twice? 10 times? More than you can even count? Because your answer actually tells me quite a lot about what might be driving this for you specifically. Go ahead and drop your number down below right now. And while you're there, tell me how long this has been going on. A few months? A few years? You might be surprised how many people watching this today feel exactly the same way you do. Let's start with something that surprises almost every patient I've ever discussed this with. And honestly, it's one of the most common causes I see in my clinic every single week: your medications. Now, most people assume that if a medication were causing a problem, they'd have noticed it right away. But that's not how this works. Some of these side effects develop slowly, over months, sometimes even years, which is exactly why the connection gets missed. Here's what's actually happening inside your body. Certain medications that are extremely common in adults over 60, blood pressure drugs called ACE inhibitors, water pills or diuretics, older antihistamines, certain antidepressants, and even inhaled steroids, all interfere with your throat and airway in different ways. Some stimulate mucus production directly. Others dry out the delicate tissues lining your throat, which paradoxically creates that thick, sticky sensation that feels exactly like excess mucus. And some actually thicken your natural secretions, making them harder to clear. The result? That persistent feeling of something sitting in your throat, day after day, with no obvious explanation. What makes this especially tricky is that many of my patients have been taking these medications for years. They never connected the two because the symptoms crept in so gradually. So here is what I want you to do. Pull out your medication list, every single tablet, capsule, and inhaler you take regularly, and bring it to your next doctor's appointment. Ask one specific question. Could any of these be contributing to my throat symptoms? Never stop a medication on your own. But alternatives very often exist. And for many patients, a simple adjustment makes a remarkable difference within just a few weeks. Now, most people have heard of postnasal drip. But what they haven't heard, and what I find myself explaining almost daily, is that after 60, the nose itself undergoes changes that make this problem significantly worse. And it has nothing to do with allergies. Here's what's happening. The tissue lining the inside of your nose gradually thins with age. It loses moisture. It becomes far less efficient at regulating the air you breathe. And as a result, your nose becomes almost hypersensitive, reacting to things it never used to bother with. Cold air walking outside, a warm kitchen, a strong perfume, even a change in humidity indoors. This is called vasomotor rhinitis, and it is extraordinarily common in older adults, yet rarely discussed outside of a specialist's office. What happens is this. Those triggers cause the blood vessels inside your nasal lining to overreact, producing a thin, watery drip that runs silently down the back of your throat. You don't feel it in your nose. You feel it as that constant sensation of mucus pooling just behind your throat, especially in the mornings or when you step from a warm room into cold air. On top of this, nasal polyps, small, soft, non-cancerous growths inside the nasal passage, become more common as we age. They block normal drainage and quietly worsen that dripping feeling day after day. What I recommend to my patients is this. Begin with a simple daily saline nasal rinse, warm salt water, gently flushed through each nostril. Use a humidifier in your bedroom at night, and if symptoms persist, ask your doctor specifically about vasomotor rhinitis and whether a targeted nasal spray might help. This one change alone brings significant relief for a large number of my patients. This next cause is one of the most commonly misdiagnoses I encounter in older patients, and the reason it gets missed is deceptively simple. There's no heartburn. Most people associate reflux with that familiar burning sensation in the chest. So when there's no burning, they never suspect reflux at all. But there's a specific type called laryngopharyngeal reflux, or silent reflux, and it behaves very differently. Here's what's actually happening. Normally, a small muscular valve at the top of your esophagus acts as a gatekeeper, preventing stomach contents from reaching your throat. But after 60, that valve gradually weakens, and something else becomes extremely relevant here. Hiatal hernias, where part of the stomach pushes upward through the diaphragm, are remarkably common in adults over 60. This increases internal pressure, making it far easier for stomach acid to travel upward silently. What reaches your throat isn't a dramatic flood of acid. It's a quiet, intermittent mist, just enough to irritate the delicate lining of your throat and voice box. Your throat responds by producing mucus as a protective layer, and that protective mucus is exactly what you feel accumulating day after day. Two medications extremely common in seniors make this significantly worse: NSAIDs like ibuprofen, taken regularly for joint pain, and bisphosphonates prescribed for bone health. Both can increase esophageal irritation without producing any obvious burning sensation. What I advise my patients to do is this. Elevate the head of your bed by 6 to 8 inches, not just an extra pillow, but the actual bed frame. Avoid eating within 3 hours of lying down. Reduce acidic and fatty foods. And when you speak with your doctor, use the specific term laryngopharyngeal reflux, because the treatment approach differs meaningfully from standard heartburn. Many patients see dramatic improvement within just 2 to 4 weeks. Before we continue, if what you've heard so far is already making sense to you, if you're recognizing yourself in any of these causes, I'd like to ask a small favor. Hit the like button right now. It only takes a second, but it tells me this information is reaching the people who genuinely need it. And if you have a friend or family member dealing with this same frustrating problem, please share this video with them today. They'll thank you for it. Now, we arrive at something I consider one of the most underappreciated causes of persistent throat mucus in older adults. And what makes it so fascinating and so frustrating for the people experiencing it is that the very thing you're doing to get relief is actually making the problem worse. Let me explain. After 60, the muscles involved in swallowing gradually lose some of their strength and coordination. This is a natural process called presbyophagia, and most people have never heard of it. What it means practically is this. With each swallow, your throat doesn't clear itself as completely as it once did. Small amounts of normal saliva and mucus are left behind, and your brain, sensing that something is still there, sends one very familiar instruction: clear your throat. So you do, and it feels necessary, it feels productive. But here is the clinical reality I share with every patient in this situation. That forceful throat clearing actually strikes the vocal cords together and irritates the delicate lining of your throat. Irritated tissue responds by producing more mucus as a protective response, which creates more sensation, which triggers more clearing, which causes more irritation. A cycle that never resolves, because the very action meant to fix it is perpetuating it. Dry mouth adds another layer here. Many seniors experience reduced saliva production from medications, from mild dehydration, or from conditions affecting the salivary glands. Thicker, stickier saliva is significantly harder to clear with each swallow, which intensifies that stuck sensation further. What breaks this cycle? First, replace throat clearing with a silent, firm swallow whenever the urge strikes. Second, stay consistently well hydrated throughout the day. Warm water works best. And third, ask your doctor about a referral to a speech therapist who can prescribe specific swallowing strengthening exercises that genuinely rebuild muscle coordination over time. The difference this makes is remarkable. This is the cause that genuinely surprises most of my patients. Because when they think about mucus in the throat, they think about the throat. They think about the nose. They think about sinuses. Very few of them think about their lungs. But here is what decades of clinical experience has taught me. A significant number of older adults walking around with persistent throat mucus are actually producing that mucus much deeper, inside the airways and lungs, and it is simply rising upward into the throat where they finally feel it. Here's the important background. The lungs contain an extraordinary system of tiny hair-like structures called cilia, which act like a slow-moving escalator, constantly sweeping mucus upward and out of the airways. When the lungs are healthy and young, this system works silently and efficiently. You never notice it. But chronic exposure to cigarette smoke, including secondhand smoke over many decades, air pollution, chemical fumes, or even repeated chest infections gradually damages this system. The airways respond by producing more mucus as a defense. And as lung tissue loses elasticity with age, that mucus moves more slowly, accumulates, and eventually makes its way up into the throat. This is how early or mild COPD, chronic bronchitis, and a condition called bronchiectasis, a widening of the airways, quietly announce themselves, not with dramatic breathlessness, not with an obvious cough, but with that persistent, wet, mucusy feeling sitting at the back of the throat every single morning. And critically, this affects never smokers too. Decades of secondhand smoke exposure or urban air pollution can produce identical changes. What I urge every patient in this situation to do is request a simple breathing test called spirometry at their next appointment. It takes less than 10 minutes and can identify early airway changes that are entirely treatable when caught in time. We've now arrived at the most fundamental cause of all. And I want you to listen carefully here, because this one doesn't get discussed nearly enough, even in medical circles. Everything we've talked about today, the medications, the nasal changes, the silent reflux, the swallowing cycle, the airway inflammation, all of them become significantly worse because of this single underlying reality. Your mucus transport system has slowed down with age. Let me paint you a picture of what's happening inside your throat and airways right now. When you were younger, thousands of microscopic hair-like structures called cilia lined every surface of your airways and throat. They beat rhythmically, around 1,000 times per minute, like an incredibly coordinated cleaning crew, sweeping mucus along smoothly and efficiently. You never once thought about mucus because this system handled everything invisibly. After 55, those cilia gradually beat more slowly. The mucus your body produces, which hasn't increased in volume, becomes thicker and stickier because it isn't being moved efficiently enough to stay thin and fluid. The throat tissue itself loses elasticity and becomes hypersensitive to secretions that were always there but never noticeable before. This is the critical insight I want you to take from today. You are not necessarily producing more mucus. In many cases, you are simply feeling normal mucus for the very first time because the system that used to clear it silently is no longer working at full capacity. The single most powerful daily habit that directly supports this system is hydration. 8 glasses of water daily, warm rather than cold, keeps mucus thin enough for your slowing cilia to manage effectively. Steam inhalation, bedroom humidification, and reducing caffeine and alcohol all support this further. This isn't complicated, but it is genuinely life-changing when done consistently. Now, before we close today, I want to share a few additional practical tips that I give my own patients, because knowing the causes is only half the picture. Here's what actually helps day to day. First, the silent hard swallow technique. Whenever you feel the urge to clear your throat, suppress it. Instead, take a small sip of warm water and swallow firmly and deliberately. Do this 3 times in a row. It clears residual mucus without irritating your throat lining. Second, water temperature matters more than most people realize. Cold water actually thickens mucus temporarily. Warm water, not hot, just comfortably warm, keeps secretions thin and far easier to clear naturally. Third, dairy products. Many of my patients notice a meaningful reduction in throat mucus simply by reducing milk, cheese, and yogurt consumption, particularly in the morning. Dairy can temporarily thicken saliva in some individuals, worsening that stuck sensation considerably. And finally, know when to see your doctor urgently. If you notice any blood in your mucus, a sudden unexplained change in your voice, or difficulty swallowing solid foods, please do not wait. These symptoms deserve prompt medical attention without delay. Now, I want to hear directly from you. Looking back at those 6 causes we covered today, which one do you think might be playing a role in what you've been experiencing? Drop your number in the comments below, number 1 through 6. Or if you suspect more than one, list them all. Your response genuinely matters, not just to me, but to every other person reading the comments today who is dealing with exactly the same thing and finally feeling understood. If today's video gave you clarity you didn't have before, please subscribe to this channel and hit the notification bell so you never miss what we share next. We publish new videos every week covering the health topics that matter most to adults over 60, the ones your doctor doesn't always have time to explain fully in a 15-minute appointment. And right there on your screen is another video I think you'll find extremely valuable. I'll see you in the next one.